Hello, friends. Today we are going to discuss what are triglycerides. I am Dr. Jagaji Singhver, MBBS, FCG, PFMS, PGDGM. What are triglycerides? A triglyceride is a type of lipid used for long-term energy storage in the body. It is made up of a glycerol backbone with three fatty acid chains attached to it, just like a triglyceride can be saturated or unsaturated. Triglycerides are a form of fat or lipid found in your blood. Any excess calories that are not used from your food are converted into triglycerides. Saturated triglycerides have all the bonds, single bonds. The structure has the maximum number of hydrogens and there is no double bond. In the unsaturated triglycerides, there is at least one double bond and fewer hydrogens atoms. Types of fats in the body. Visceral fat, that is 10 to 20% in men and 5 to 7% in women. First to go in weight loss. Accumulates with stress, it accumulates with the stress and it surrounds our internal visceral organs. It is a predictor of metabolic syndrome. Not only that, our liver fat is more important in predicting. More insulin resistant. More fat we got in the viscera, more insulin resistant we become. It releases high amounts of pro-inflammatory cytokines in the blood. Second is subcutaneous fat. 80% of total body fat is in our subcutaneous tissue. It is a stubborn fat. Estrogen increases this type. Maybe in ladies or in obese person when the testosterone is converted into estrogen. May play a protective role in our body. Less metabolically active and normal buffer system for excess energy intake. This is the storage of energy in our body. Problems with high triglycerides. High levels linked to liver and pancreas issues may trigger acute pancreatitis and it may increase the risk of non-alcoholic fatty liver disease. Along with poor cholesterol may affect kidneys and may increase the risk of heart disease. Complications of high triglycerides. High levels of triglycerides increase your risk of pancreatitis. This severe and painful inflammation of the pancreas can be life-threatening. High triglyceride levels also increase your risk of heart and vascular disease, including carotid artery disease, coronary artery disease, and heart attacks, metabolic syndrome, a combination of high blood pressure, diabetes, and obesity, peripheral artery disease, and strokes. Risk factors for high triglycerides. Obesity, leading a sedentary lifestyle and lack of exercise, eating more calories than burning in exercise or movements, eating a lot of processed foods, the patients of type 2 diabetes, patients of kidney disease, hypothyroidism, and those who smoke, excessive alcohol consumption, certain medications, and some genetic disorders may also contribute to the risk factors of triglycerides. Levels of triglycerides. Normal triglycerides under 150 milligram per deciliter are normal. Borderline high triglycerides between 150 and 199 milligram per deciliter. High triglycerides between 200 and 499 milligram per deciliter. And very high triglycerides 500 milligram per deciliter and over it. Functions of triglycerides and cholesterol. Triglycerides and cholesterol are both fats or lipids in your blood. Triglycerides store calories inside our fat cells to be used for energy later. Cholesterol, on the other hand, is needed to build cells and create certain hormones. HDL cholesterol. Good cholesterol, that's so-called, is HDL, high density lipoprotein cholesterol. It helps to return cholesterol to the liver and prevent plaque in your arteries. High density lipoprotein cholesterol is critical for reducing your risk of blood clots, heart disease, heart attack, and stroke. LDL, low density lipoprotein cholesterol, so-called bad cholesterol. LDL transports cholesterol as well as fat-soluble nutrients like vitamin A, D, E, and K2 to your tissues through the arteries. Certain types of LDL cholesterol are prone to oxidation in the arterial walls. Oxidized cholesterol can lead to arterial plaque that limits blood flow and cause blood clots, blocking blood flow to your brain or heart and risking a stroke or a heart attack. What is an optimal range for the lipid profile? Total cholesterol 180 to 300. The test will flag it as high if it is over 200, but we aren't concerned about it if the ratios below are in range. LDL and HDL ratio 3 to 1 or less, 2 to 1 is great. Triglyceride and HDL ratios 2 to 1 or less, or 1 to 1 is great. Triglyceride should be under 100 and ideally right around that some number. As HDL or in the 40 to 80 range, if these ratios are in order, it is a sign that the LDL particles are the larger fluffy types that are less prone to oxidation. How an anti-inflammatory lifestyle impacts the lipid profile. That increases LDL particle size to the less oxidation prone state. That increases the amount of HDL, high density lipoprotein, available to recycle low density lipoprotein from the blood before it has a chance to become oxidized. That improves the low density lipoprotein to high density lipoprotein ratio. It lowers triglycerides and improves triglyceride to high density lipoprotein ratio. Blood investigations. HbA1c. The ideal number is between 4 and 5.2%. 5.3 to 5.6% is moderately high. Between 5.7 and 6.4 means that you have pre-diabetes and a high risk of developing diabetes, and over 6.4 means that you have diabetes. Fasting glucose. Optimal levels are under 90 milligram per deciliter. Less than 100 milligram per deciliter, that is 5.6 millimole per liter, is considered normal. 100 to 125 milligram per deciliter, that's 5.6 to 6.9 millimoles per liter, is considered pre-diabetes. 126 milligram per deciliter, that is 7 millimole per liter or higher on two separate tests, means you have diabetes. Fasting insulin. Optimal fasting insulin levels are between 2.5 to 5 international unit per milliliter. Between 6 to 9 international unit per milliliter is early insulin resistance, and anything over 10 units per milliliter is insulin resistance. This won't be flagged on the lab until it is over 24.9 international unit per milliliter, which is a state of severe insulin resistance. Inflammatory markers. High sensitivity CRP. The ideal number is under 1. 2. LDH lactose dehydrogenase. The optimal range is 140 to 180. High levels indicate chronic inflammation in your body. 3. Serum ferritin. The ideal range is under 150. High levels indicate inflammation in your body. Homocysteine. The optimal range is 6 to 9, or more precise, less than 5. Functional root causes of high triglycerides. Functional root causes of high triglycerides include insulin resistance, oxidative stress, inflammation in the body, hypothyroidism, subclinical low thyroid, vitamin D deficiency, zinc deficiency, chronic infections, and certain medications. Best ways to reduce triglycerides. You eat low carbs. You have anti-inflammatory nutrition plan. Commit to intermittent fasting. You daily have movements, exercise, and strength training. You reduce your stress and improve sleep quality. Optimize vitamin D levels in your blood and zinc levels. Use omega-3 fatty acids routinely, and use turmeric or curcumin in your food and as a supplement. Optimize glutathione levels. Anti-inflammatory nutrition plan. Remove all these refined sugars, refined oil, artificial ingredients, additives, junk food, and processed food. Follow a lower carb diet with lots of healthy fats and moderate clean protein. Eat plenty of greens, vegetables, fermented food, herbs, spices, low glycemic index fruits, nuts, seeds, grass-fed beef, pasture-raised poultry and eggs, grass-fed butter and ghee, wild-caught fish, and wild game. grass pasture fed meals, poultry and wild game, lemon, limes and berries, avocados and avocado oil, green tea, non-starchy vegetables, turmeric, wild caught fish, bone broth and vegetable broth, apple cider vinegar, ginger, organic extra virgin olive oil and olives. Fermented vegetables, coconut oil, coconut butter, coconut milk, coconut flakes, basil, oregano, rosemary, thyme, sage, etc., garlic, onions, and chives. Pro-inflammatory foods to be avoided at all. Refined grains, whole grains, grain flour products, deep fried foods, processed foods, and most packaged foods, grain-fed meat, fast foods, soda pop, most commercial salad dressings, trans fats, margarine, some oils like corn oil, safflower, sunflower, and soybean oils. Thank you very much.